Welcome to Pull Up with Limbs and Things and happy March. Tonight we're talking about questions to ask your physicians to make sure that you don't leave any questions unanswered or stuck in your head when you leave the doctor's office. And tonight we have Miss Barbara Bonsu. She is a nurse practitioner and the owner of Housecall Practitioner Services. And we welcome you tonight. How are you?
Hi, I am fabulous. Thank you so much for having me on, Dr. James. It's a pleasure.
Absolutely. I'm glad to have you. I want you to do a little talking to us about some of the things you see, but also some things that we should know to do whenever we see our physicians or our nurse practitioners. So, pull up with limbs and things is to give you an opportunity to share something you know, challenge something you don't know, and confirm something that you do know. So, we want you to, and we invite you to put your questions in the chat. You can let us know if you're watching us live by hashtagging live, or if you're catching it on a replay, hashtag replay. All right, so let's talk about it. Tell us a little bit about you first.
Absolutely, gladly. So my name is Barbara Bonsu. Of course, I'm a nurse practitioner. People are like, what is that? Everyone should know by now, if you go to a medical office, we're here, we're staying, we're dominating the industry, we're taking over from the physicians. No offense to the physicians. We still love you. Nurse practitioners definitely are special kinds of nurses that are able to prescribe and diagnose and treat patients under the primary care provider kind of scene, if you will. And we do a really amazing job. And we have that nursing background. So, therefore, our bedside manner will be totally different and very holistic in approach. As you can see, I am the owner of House Call Practitioner Services. And this service is really designed for seniors, your 60 plus, seniors who reside in retirement kind of community areas.
Mhm.
However, I notice that typically a common thread or a common theme with my seniors, but also with others, even with maybe the caregivers of these seniors and so forth, is, man, so I'm waiting in the medical office for about 30 minutes. And then I get whisked into a room and I'm there. The provider comes in and they're there for about 5, 10 minutes. And I can't
Mhm.
remember what I needed to ask them.
Right.
What should I do? How do I prepare for this?
Mhm.
So, because that is a continued thing that I see amongst my patients or their caregivers, even myself, I mean, I have children and, family members, that I, help and advocate for their care in
Mhm.
some way. So there is those times where I'm like, geez, I meant to say this. You're trying to just hit home, get in
Right.
there, do what needs to be done. So I typically tell my seniors, particularly, that there are these, maybe the four big main things you want to ask when you go in. So let's just say, the doctor is putting you on a new med, or the provider is putting you on a new medication. You want to know what am I taking, or what is this going to do for the problem,
Mhm.
whether it's for my blood pressure or my diabetes.
Right.
That's one big thing you want to ask. I know these things are going to seem simple, but you want to be able to understand what exactly this person is prescribing is going to do for you. So then the other one is, when will I start to see a change in the problem with the treatment you've given me? You
Okay.
want to know that because you want to be able to say, hey, okay, this medication is working, or this treatment plan is working for me, or it's not working for me. Let me follow up with the provider, or call and say, hey, it's been XYZ, number of days, and you informed me, when I was supposed to have this change, and I don't notice anything. Those are
Mhm.
important. Those are like the two big ones. The third one is where. Where will the medication or therapy affect me? Now, I know everybody's like, what? Where? Yeah. Where will it affect you? Where will it impact you? A lot of times when we're given medications or treatment, we don't know what side effects may come along with it and or what to look out for, what's normal and what's not normal or abnormal.
Or you
So
wait to ask the pharmacist.
yes, yes. Now that is a situation that you definitely can, jump on. You ask the pharmacist. I love my pharmacist that I work with. So yeah, I definitely encourage that as well. But I also like to ask the provider who's prescribing when they're prescribing it, because
Mm-hmm.
for me, I tell my patients earlier on, I like to tell them what to expect. If I'm prescribing you an antibiotic, yeah, you might have diarrhea from this one. So don't freak out. It's going to be a couple of days. I like to have those conversations because when I'm straightforward and transparent with you, you not only trust me, but you understand, okay, I don't need to flip out. I feel comfortable in knowing this is what I can expect.
Right.
Um, and the number four question I usually tell people to ask is the how. How long will I need to take this medication or this therapy? Just
Mm-hmm.
so you have a kind of grand scheme of when you are expected to kind of be done, or is it going to be forever? What to expect. A lot of times that how is the game changer, because
Absolutely.
people may say, okay, my doctor prescribed, I don't know, this medication for me. And I'm not sure how long I want to take it. Or they've started taking it. It's been a couple weeks. They don't like the side effects, and they don't know that, maybe this is an abnormal or a normal side effect. And they're like,
Mhm.
I'm going to stop taking this and not tell anybody. And sometimes those rebound effects can be worse. So
Right.
that how is definitely important. Any questions while I'm rambling on?
Well, I don't see any in the chat, but I have a few. I think it's
Sure.
important that people ask that how question, and not just about like their medication, but why they are needing to follow up within a certain amount of time. Like if it's not a year, if it's 6 months, if you're asked
Mm,
to come back in like a month, that those are different parameters. And so you kind of need to ask why. And a lot of times I find that older people, we tend to always think the doctor is at a higher level, so we don't ask the questions that we really want to ask. Do you
right.
find that?
Yeah, absolutely. It is definitely noted amongst certain generations, like my older folks. But however, when they're under my service, they understand like this is a holistic approach. You and I are working together, or I,
Mm-hmm.
and your caregiver are working together on one accord. And I want you to understand thoroughly and feel as though I'm being transparent with you and you can be transparent with me, and we can make things work for the betterment of your lifestyle.
Absolutely.
Because I don't want you to be afraid to ask me questions or embarrassed.
Mm-hmm.
These things, this is important. This is your health. I want you to advocate for you as much as I'm going to advocate for you. And if I don't know something, I'm really different. I'll tell you, if people are really, I know Google is a thing, right?
Oh,
Because people
absolutely.
Google something and say, "Hey, did you hear about this medication?" Like,
Hmm.
and there
Or
are some
if they're watching an infomercial at night and they come to you and say, "Well, have you heard about this drug or
right.
this?" Yeah. Mm-hmm.
I'll tell you, like, hey, yeah, I have, or let me look into that. Let me get back to you. I'm very genuine in that approach. I'm not like, oh, I know it all. No, I'm not like that. And I don't want my clients to think that I do come across as, oh, I know everything. And you should be on a certain level to even ask me a question, because that's not where I'm at. I'm here to do the work for you to make sure that you are happy with the lifestyle that you're living, with the health that you have, and what we're trying to execute.
Absolutely. So tell us a little bit about house call practitioner services and the services that you offer.
Absolutely, absolutely. So we are a service that caters to our senior population in Prince George's County, Maryland, in particular.
Mhm.
We service. We used to do individual home visits. Now we have come away from that. Unfortunately, we have kind of centralized everything to a retirement community that we service. So if you know of, someone who could benefit from that service, and they live in a retirement community setting, definitely, you go to our website or you can give us a call. You see the information there. Um, we do primary care services, meaning instead of that senior having to go to the medical office to see the provider, we come to you. We come directly to your doorsteps. It's healthcare at your doorsteps is what we kind of, have as our motto.
Mhm.
And we definitely make it worth your while because you're not seeing us for like 5-10 minutes like you would in an office where you're like, I hope my provider even knows my name, you know. You're seeing us when you see, like, usually my first visits are they can be up to 45 minutes to 60 minutes because
Mhm.
I'm coming into a comfort zone for my clients to basically show me the medications that they're on, ask me those questions, those four main questions: the what, the when, the where, the how, you
Mhm.
know, and get them very comfortable in that. I want them to leave feeling like, okay, if this is the year that I want to lose weight, or if this is the year that I want to be better, improved in my numbers for my diabetes, this would be your year. You can do that. You can feel comfortable and confident to have that conversation, and we can make a plan to execute. Um, and we also do labs on site. I work
You do labs on
with
site.
come and do
Mhm.
the lab work. What's
Mhm.
that? Yeah.
You
So
were
we
frozen a
also
little bit on my end. You said you were doing labs on site. Can you say that one more time?
Yes, so we do
Okay.
labs on site, now if you are a type of person who likes to go like to a local patient care center to have your labs done, that's fine too. I can electronically send them. That's not an issue. As a primary care provider, we do that, but we do offer that on-site labs. And I also work with a company that does the pharmacy deliveries where they deliver on site. So
Nice.
it's really the healthcare at your doorsteps that we bring, because I want that primary care to experience to be for each and every one of my clients to be comfortable, to
Mhm.
be, less stressful, no having to arrange transportation, get an Uber or anything like that. We come to you.
Yeah.
And that's what we do with House Call Practitioner Services.
Awesome. You do have a question. Does insurance cover this service? If so, what type of insurance do you take?
Yes. So, yes, insurance does cover the service. They will cover some of our services, especially the house calls. Um, they don't cover the phlebotomy team coming on site. So, therefore, what we do to kind of buffer that, and with the pharmacy, to buffer that, we do have like a monthly kind of copay coverage that you would pay. The type of insurance that we do take is we take Medicare as primary, and you definitely can have a Medicaid as secondary. Now, um, there is also, I know there's Advantage plans out there. So the one that we are subscribed to at present is the Care First Blue Cross and Blue Shield.
Hmm.
So we accept them as well. Whether you just have it without an Advantage plan, Medicare Advantage plan package, or if you do. So we do both on that end. And we do private pay, which, some of our clients, they do kind of branch to be maybe like, I'm on the brink of getting to be 64, 65.
Hmm.
I'm not there, but I'd like your service.
Hmm.
And they're like, hey, if my insurance doesn't cover it, I'd rather go under your private pay. That's absolutely fine for us as well.
Good. Okay. Outside of pharmacy or drug questions. Are there any questions that you find that people are neglecting to ask their providers?
Hmm. Yes. Let's say I'll take it in two different areas.
Okay.
One is about screenings. Now, every provider, I can't say every provider is going to do this, but I know that I do. But if they haven't, it's important for you, whatever age you are, you should always, if they haven't said anything about it, um, the screenings, we want to be our best selves.
Mm-hmm.
So I would encourage, if your provider has not mentioned to you, let's say, again, I'm sorry to be a little biased. I deal with seniors, so I'm going to use that as an example. But let's say, as with my seniors, we talk about colorectal, cancer screenings.
Mm-hmm.
Those are things that maybe people don't understand how often you should, have the screening done and how important it is, because unfortunately, as we get older, our bodies change, and
Yeah.
these whole screenings, they may seem so stressful or extra to do, but it is a task that a lot of my seniors, they actually step up to do it. I mean, I have some of my seniors are in their 70s and they're like, "Hey, I still want to get my pap smear," and
Mm-hmm.
I'm like, "Hey, you know what? I don't we can advocate for that. Some insurances will cover it, some don't. But yeah, we can definitely refer you out to, get those type of screenings done. For well women exams, if you will. And
Mm-hmm.
my men, I'm like, look, I'm on them about the prostate screening. That's important,
Mm-hmm.
because sometimes people get in this mode of, okay, I don't feel like going to have these screenings done. And I want, in terms of my seniors, I want them to always think incontinence, meaning if you're having issues with urinating, that can change your whole life. And
Mm-hmm.
you do not have to say, oh, this is just a part of getting older. That is not. Let's not make that the norm. We get
Right.
screened for these things. So screenings are, a big thing, I believe, and I advocate for my clients and everyone out there, no matter what age you are. If no one's talking about screenings, you should ask, hey, for my age range, what screening should I have done, or should I do during this time? That's important. The other avenue I would take is the whole thing about not questions, but, well, yeah, no, 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 not questions for the clients when they come in. If you're the
Mm-hmm.
patient, I'm going
Mm-hmm.
to say the other avenue is how to give information to your primary care provider. You should come down to thinking, all right, if you have a problem, what is the problem? Come in, boom, this is my problem. Next question that you need to think about: when did this problem start? You should know, my problem started 2 weeks ago, 2 days ago, last night. The other thing is, where is this problem affecting me? Like, you should know, okay, this problem is, I'm having indigestion. It's affecting me in my chest, and it goes to the left or to the right. Um, and then the last thing you should definitely think about when you have a problem and you want to get this correct information to the primary care provider, you want to say, how have you been managing this problem? That's important. Those things are important and key, because it allows the provider to be that detective they need to be, to zone in on exactly what needs to be done for you. And it would behoove you to have that on board when you're trying to, tell somebody about what's going on with you, because they can find out what we need to do and get you the correct treatment right away. So,
Now that statement goes across the board for any
absolutely.
healthcare provider, because we all have to pull for scraps a little bit when we're trying to get information, and it just is so helpful to have that timeline so that we can all be on the same page. So yes, thank you for
Absolutely.
sharing that. You do have another question. Do you have any meals to service the male patient?
Right now, mm, we don't have any male nurse practitioners or primary care providers on board right now. We
Mm-hmm.
do have male phlebotomist that services male patients, though, when they come on site to draw labs or to pick up specimens. Yeah.
Okay. All right, no problem. So, is there anything that we have not discussed that you would like to share with the population that is watching that would be beneficial, say, on their next physician visit, which you must do?
Well, I pretty much gave you the gems.
Hmm. You can repeat them if you like. We got to
Sure.
hear it a couple times.
Just kind of as a summary, the I'll work backwards. So the last thing I mentioned was the information to give your primary care provider when you have that visit. And what's important to know. If you have a problem, you want to tell them what the problem is.
Hmm.
When did the problem start? Where the problem is impacting you, and how have you been managing this problem since it started? And as I said, working backwards, the important things to ask is specifically about your age range and what in terms of what screenings are very important for you to have. um, is it a mammogram that you need this year? Are you 40 plus? They'll tell you, okay, well, for your age, if you're over 40, mammograms are us right now. Welcome to Club 40. Vision screenings,
Hmm.
prostate, all these things will come into play if you ask them about what screening should I have right now, just to make sure that I'm healthy. Um, and last but not least were the simple questions you should ask if you go to your primary care provider during that first visit, or if it's a visit where you're returning. You want to have a conversation in respects to what you are taking or going to do for a problem. And when I say problem, that's probably like really basic, but like if what I'm going to do to manage my chronic diabetes, or whatever it is that you're taking medications for. um you should know about what you're taking, so ask that. When will you start to see the change in your diabetes if you're taking new diabetic medications?
Hmm.
Where will the medication or therapy impact you? Is there going to be some side effect that's common that you should know that you're going to may experience? And lastly, how long will you have to be on this therapy? How long will you have to take the medications? That gives you a kind of perspective of, am I with this or not?
Right,
I
right.
that way, I as your provider know if you're going to be compliant or not, and we don't have to mince words. I'll know if you're not with taking this prostate medication. You'll say, "Hey, I don't like it. It gives me erectile dysfunction, lady." Mm-mm. Okay, let's try something else.
Hmm.
Maybe we need to look at other alternative avenues, and we can do that. But the only way that discussion will happen is when you tell the provider how you feel about something, when you get that information of how long you're going to have to take something.
Yes. Now I agree. I think the thing that we probably didn't talk about yet is the fact that you probably should write these things down before you go to your appointment, because there are a lot of times where you just get stage fright because you're in front of somebody new, or
Yeah.
you're just forgetting because you've rushed there or whatever the case may be. So it's always helpful to me, I always suggest that you write your questions down before you go there. Think about everything that's really going on with you, because a
Hmm.
lot of times we get in there and we just may forget, oh man, this happened the other day or this happened a while ago and now it's
Right.
better, but I should probably still say because it could possibly impact how I'm feeling now.
Absolutely. You know what? That is definitely the thing that I almost left out. Thank you so much. Definitely
Mhm.
write it down. If you can't remember, I'm one of those people. I'm like, yes, I'll do this, but I carry a notebook, a little notepad, because
Mhm.
I'm really like, I need to write stuff down, because then I can kind of go back through, okay, if I'm in front of that person that I want to present something to, oh yes, exactly. This is what I wanted to talk to you about. Make sure
Right.
I get my bullet points out so we can get it done and execute it. So yes,
Mhm.
absolutely. Take notes, write them down at home before you go in. That way you're like, yeah, so I want to talk to you about X, Y, Z. Can you help
Right.
me?
Exactly. Yeah, I do have a question for you, just as a follow up, because there are a lot of times that we only think that medication is the option that we
Mm,
can use to improve our situation. So, and a lot of us tend to not ask
mm.
what other options or alternatives we can use instead of medication to improve our health. So, would that be a question you would consider as well?
Absolutely. And, I'll revert back to what I said earlier when I said, okay, sometimes people are like, oh, have you ever heard of this? Or, I hear
Hmm.
that this particular vitamin is good for XYZ. And I'm like, yes, I've heard of that. I didn't know it was good for that. Let me look into it. Or, that area may not be my expertise, but I know who is an expert in that area. And let me link you to that person.
Yeah.
I understand and respect that there are alternative ways of doing things. And sometimes, you know, medications may not be that route that we want to take. And so I respect that. And definitely, I welcome those questions as well.
Okay. Well, if you are watching and you have a question, you can feel free to put those in the comments. I want to thank you so much for joining us tonight and sharing about house call practitioners, as well as those questions that are pertinent for us to know before we see our physicians. Is there anything else you want to add before we go?
I guess the last thought I wanted to just drive home or reiterate is that definitely to your listeners, I encourage whether you see me or anyone else, any providers, always, 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 whether it's for yourself or your family member, if you're caring for someone, advocate for you,
Mm-hmm.
advocate for that person that may not be able to advocate for themselves. So you want to be able to speak up and, say, hey, here's the questions that I have regarding my loved one.
Mm-hmm.
Um, and excuse me 1 second.
Sure.
All right. Yeah. No. The burgundy one's with. I'm on live. It's my mother. Sorry about that. But yeah, so you want to be a great advocate for your family member or yourself. You want to stand up and say, hey, um, I have this question for my loved one, and I'm concerned about this. When you do that, healthcare providers understand that you're taking your situation serious if it's for yourself, but they also understand you're taking that other person's health serious if it's for someone else. And they, should in essence feel that energy and understand, okay, I got to, make sure I do what I need to do for this person. And you'll notice sometimes, well, providers like myself, what we tend to do is we tend to try to make sure that we can make it in a way where you feel so comfortable that, you know, that's why I say for myself, I like to be transparent. I like to tell you what's ahead,
Mm-hmm.
because if you tell me I'm really concerned about this for my mom, and I really am concerned about that, I'm going to tell you, okay, this is what we can do to ease your concern. What we'll do is this: we'll follow up in another week, in a week, to monitor whether or not this was, a therapy that was, good for her, or, do we need to follow up in 2 weeks? Or I'm going to give you a call. I'll follow up with a call. It doesn't have to be in person. But those are the things you want to do. You want to advocate for yourself and your family members, because that's when people realize, okay, this person is serious. So they take you serious and what
Yeah,
you're
absolutely.
into.
Well, thank you so much. And thank you, everyone, for watching. I hope you have gained some information as to what you should do when you go to your next appointment so that you don't leave any questions unanswered. Thank you so much for joining us.
Thanks for
Hope you
having
all
me.
you're welcome, and have a wonderful weekend. Take care, everybody.
Too. Bye now.
Bye.